Welcome guys back to my channel Dr. Seal for Knowledge. Today I will listen about the spinal nerve structure, branch of spinal nerve plexus and cervical plexus. Today I will explain only about cervical plexus, the other plexus in the next videos. The spinal nerve, it consists of 31 nerve, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, 1, 2, 3 coaxial. The spinal nerve, they are rough and more cord-like than tissue of the central nervous system because of 3 connective tissue layers that surrounded them. Each spinal nerve made by nerve fiber enclosed bundles called fascicles surrounding the entire peripheral nerve and bind together to make a tube of connective tissue called epineuron. So spinal nerve fiber collected and binded together to make fascicles. These fascicles are connected and binded together to make the epineuron, which is tube of nerves. Also with the epineuron found blood vessels and lymph vessels. Some small nerves don't have epineuron because they are small and branch of them. They have a thicker sheath of perineuron in cases of each vesicles of nerve fiber, and each of these nerve fiber covered by endoneuron, a separated individual nerve fiber. So here in this picture we can see this is the nerve trunk, consists of vesicles. This one is vesicles, bunch of nerve fibers. So the nerve trunk is covered by epineuron. Okay, it has blood vessels and lymph vessels. It's not here in the picture. The perineuron is covered with the vesicles. Here's the vesicles covered by perineuron. The endoneuron covered the spinal nerve. This one. Branch of spinal nerve. A short distance after joining the dorsal and ventral roots join together to form spinal nerve. Focus on this one. Dorsal and ventral root join to form spinal nerve. The nerve divided into several branches called rami. They are dorsal ramus, ventral ramus, meningeal ramus, rami communicans. The dorsal ramus posterior rami innervate the skin of the back, skin back of the head, deep muscle of the back. The anterior ramus, rami, innervate the nerve of the chest, skin of the neck, abdominal wall, both pairs of limb and pelvic area. The meningeal ramus innervate the vertebrae, spinal meninges, and spinal blood vessels. Rami communicans are composed of sensory fiber associated with the vascular nervous system and motor associated with the autonomic nervous system, because the vascular nervous system consists of sensory and motor. The motor is autonomic. Okay, innervation the vascular structure, it refers to communicating branch between the spinal nerve. Why they call the communicating branch? Because they communicate the spinal nerve and the sympathetic trunk. It usually refers to one of the following: gray ramus communicans or white ramus communicans. The gray and white rami communicants are responsible for conveying autonomic signals specifically for the sympathetic nervous system. Here in this picture we can see the spinal cord. It has ventral root and dorsal root. After going through the vertebral foramen, they call the dorsal ramus and ventral ramus. Here in this picture we can see the rami communicants connecting the spinal nerve with the sympathetic trunk ganglia. Sympathetic trunk. The plexus, the ventral rami of spinal nerves, except second thoracic to 12 thoracic spinal nerve, are adjunct to form several plexes. Complex network. The plexes are complex network of nerve called the plexus. The other spinal nerve are stored and recombined to associated with the particular peripheral nerves. So they will be composed of fiber of several different rami, except the second thoracic to 12 thoracic don't form plexus. Each ramus that innervates segment of the thoracic and abdominal wall. For the second thoracic to 12 thoracic, they innervate the segment of the thoracic wall, but the others making plexus. These plexes are cervical plexus, brachial plexus, lumbar plexus, sacral plexus, and coaxial plexus. The cervical plexus composed of ventral rami of spinal nerve from cervical 1 to cervical 4 spinal nerve, and they placed into 4 groups. The cutaneous, meaning the cutaneous sensory, it meaning the skin. They innervated the skin of the skull near the external ear, the skin of the sides and front of the neck, the skin of upper portion of shoulder and thoracic. Next one, we have the ansa cervicalis, Latin meaning handle of the neck, loop-like structure. Its superior and inferior roots, it consists of superior and inferior root, provide motor innervation to strap muscles attached to hide bone. Strap muscles attached to hide bone. The superior root of ansa cervicalis is formed from cervical spinal nerve, of first one of the cervical plexus. These nerve fibers travel in the hypoglossal. This one being the first cervical spinal nerve. These nerve fibers travel in the hypoglossal nerve. This one will connect to the hypoglossal nerve, the superior one from the first cervical, and the hypoglossal nerve are the 12 cranial nerve. I'll talk about them later. The inferior root of the ansa cervicalis, also known as descending cervicalis, is formed by fibers from spinal nerve, second and third cervical spinal nerve. 3. We have the phrenic nerve from cervical 3 to cervical 4 and cervical 5. Descend into the thoracic to innervate the diaphragm. It's important to human life. 4. Some nerves provide motor innervation to prevertebral muscles of the neck. These muscles assist in the flexation. These some of the nerve of the cervical plexus help in flexation of the neck by innervating some other muscles of them. I will make a video. I will make a post about them in the Facebook page, talking about these nerve that innervating the neck muscles, because they are about the name of them and the location in the neck. No need to video. Here we can see the greater occipital nerve. This picture. This is the cervical plexus. Greater occipital nerve, lesser occipital nerve behind the auricle, third occipital nerve, and nerve number 4 in the cervical spinal nerve, and 5 spinal nerve, cervical spinal nerve. Here we can see the greater auricles nerve and the transverse cervical nerve, and medial, intermedial, lateral, supraclavicular nerve, which they innervate the clavicular bone, muscles near them, etc. The ansa cervicalis, the ansa meaning loop. Its loops which lies in front of the carotid sheath, near the jugular vein in the neck. This one you can see here. This is the jugular nerve, internal jugular vein, and the internal carotid artery. It's formed by union of two descending nerves. The first descending nerve are descending hypoglossal superior root. They form the ansa cervicalis. The second descending nerve is the inferior root. The inferior root innervating the 3 muscles that connected to the hyoid bone, the omohyoid, sternohyoid, and sternothyroid muscles. These 3 muscles that innervated by the inferior roots of the ansa cervicalis. Clinical significance for the phrenic nerve. Now, the number 3, the phrenic nerve, the clinical significance. Irritation of the phrenic nerve leads to the hiccup reflexes. A hiccup is a spasmodic contraction of the diaphragm, which pulls air against the closed folds of the larynx. What is the hiccup? Hiccup is an involuntary contraction of the diaphragm that may repeat several times per minute. The hiccup is an involuntary action involving a reflexes of R. This one. Once triggers, it means the innervating sending the impulses. The reflexes causes strong contraction of the diaphragm, controlled by the reflexes arc, followed by about a quarter of a second later by enclosure of the vocal cords, which result in the hic sound. The next clinical significance for the phrenic nerve is arises from the neck, third cervical to 5 cervical, and innervated the diaphragm, which is much lower. Hence, patient suffering spinal cord injuries below the neck are still able to breathe effectively despite any paralysis of the lower limb. If he get injury in the cervical 3 to cervical 5, he will not able to breathe because the diaphragm will be in relaxation condition. The lungs will be collapsing because the working of the lungs is depending on the intercostal muscles and the diaphragm. Here we can see in this picture the 3rd, 4th, 5th spinal nerve that have a branch and connected to each other to making the phrenic nerve that passes through the heart, epicardium. This one covering the heart, epicardium layer, and then innervating the diaphragm. This is the left phrenic nerve, the right one. No, not this picture. Here the reflexes arc. Neural pathways that control reflexes in vertebral. Most sensory neurons don't pass directly into the brain, but synapses in the spinal cord. This allows for faster reflex action to occur by activating spinal motor neurons without a delay of routing signals through the brain. This is for faster movement, faster action. If you get an injury or serious condition or accident, he will be faster to respond. There are two types of autonomic reflexes arc affecting inner organs and somatic reflexes arc affecting muscles. The autonomic affecting the inner organs, the somatic for the muscles. The autonomic reflexes sometimes involved in the spinal cord, and some somatic reflexes are mediated more by the brain than the spinal cord mediated. Better than in the brain, better than the spinal cord. This is the finish of the video. Please like, subscribe to support me posting more videos about medicine. Thank you for watching.